is Ms. Angela Vázquez from Los Angeles. Ms. Vázquez is an individual with long COVID and the policy director for the Children's Partnership, a nonprofit organization that advocates for children's health equity. She has advocated for the long COVID patient community since early in the pandemic. Ms. Vázquez, thanks very much for being with us.
Thank you, Chairman Sanders, Ranking Member Cassidy, and members of the committee for having me here today. My name is Angela Meriquez Vázquez, and today I'm here to speak as a disabled former athlete, long COVID patient, and former president of Politic, the grassroots patient-led health justice organization that was at the forefront of long COVID advocacy. Before we had to close due to a lack of funding, we connected and supported over 15,000 long COVID patients worldwide, the vast majority of whom were from the US. Before getting COVID-19 in Los Angeles in March 2020, I was a healthy runner for nearly 2 decades. What started as a mild illness progressed over weeks with an increasingly scary set of symptoms, including severe levels of blood clots, a series of mini strokes, extreme confusion and numbness in my face, hands, and legs that progressed to an inability to walk for several days, and new onset allergic anaphylaxis after every meal. I had many clinical signs that something was wrong within weeks. High markers for an autoimmune disease, labs that showed my blood was severely clotted, markers of an overactivated and exhausted immune system. All were dismissed by doctors as anxiety, but now are being verified by the decades-long overdue research as clear evidence of infection-related pathology. I was left to fend for myself from bed that first year because I did not fit the profile of who was considered high risk. There wasn't even acknowledgement that infections could trigger chronic disease, something I knew when I first got sick, since I have a friend who has lived with chronic Lyme for years. I was a young person of color, not elderly and white. Now, even the CDC's data shows that Latina and LGBTQ plus communities are currently experiencing the highest levels of long COVID in the US, and there is strong evidence that people of color are not prescribed antivirals like Paxlovid at the same rate as white people. The medical neglect and discrimination I face contributed to my current level of disability and continues to harm patients like me. With long COVID, I have several chronic diseases, including myalgic encephalomyelitis, also known as chronic fatigue syndrome, or ME/CFS. It's a neuroimmune condition whose hallmark symptom is post-exertion symptom exacerbation or post-exertion malaise, which means when I push myself past a dynamic threshold, I will experience a relapse of my worst symptoms like insomnia, brain fog and confusion, sleep apnea, heart palpitations, fevers, and severe migraines. I'm on 12 different prescription medications, including weekly IV treatments at the hospital. I have a strict pacing regimen that allows me to work from home, but not do much else. I don't socialize, I don't enjoy my old hobbies, and I don't really leave my home, especially now that I'm considered high risk. I'm actually on the mild end of disability and now have access to a lot of medical support. Patients who have had ME/CFS for decades guided me to the right specialists who are familiar with infection-triggered diseases like dysautonomia, mast cell activation syndrome, and ME/CFS and how to manage them. My employer has been supportive in accommodating my needs, like frequent breaks and working from home where I can work while laying down. Low-income and patients of color who are more likely to get COVID-19, long COVID, and have the least access to healthcare are likely experiencing the greatest levels of disability and medical neglect and largely remain unidentified or unsupported with their new disabilities by the healthcare system, employers, and schools. Having insurance doesn't necessarily guarantee access to care. Long COVID patients with managed care plans especially are at the mercy of overwhelmed primary care doctors unfamiliar with infection-triggered sequelae who gatekeep access to specialists who can diagnose and manage the known pathologies. I recently had to assist a colleague, a health access lawyer, navigate her own HMO to get her son a long COVID dysautonomia diagnosis after 2 years of constant symptoms. There is also an escalating health access crisis with the return of Medicaid eligibility redetermination this year. Having to prove that you are still poor is a time-consuming, stressful, and bureaucratic process that contributes to millions of otherwise eligible people losing their health insurance because of application errors or misnotifications. Hundreds of thousands of disabled long COVID patients are new Medicaid recipients who may have moved or due to their financial or employment changes, or they may simply be too ill to understand and fill out the forms as I have been during relapse. My insurance keeps me stable enough to work, and I need to work to keep my insurance. A horrible double bind. We are living through the largest mass disabling event in modern history. Not since the emergence of AIDS has there been such an imperative for large-scale change in healthcare, public health, and inequitable structures that bring exceptional risks of illness, suffering, disability, and mortality. COVID-19 is but the most recent driver of a known phenomenon of post-viral illnesses that cluster around a set of understudied complex chronic diseases and are compounded for marginalized communities by social drivers of health. With enough political will, we can fund a long COVID moonshot that transforms clinical and community care for all of us. Thank you.